I became a physician largely because it allows me to use kind of my natural talents with doing something that seems to benefit people in society. And that seemed to work for me. I'm John Manta, an orthopedic surgeon here at Penn Medicine. We are the mechanics of the human body. That's what we do. We replace your shoulders, knees, and hips. My practice is interesting. I'll see somebody from 3 years old with like a little buckle fracture of their wrist to somebody who's 99 with a hip fracture. So, my day can be very varied. We see, an ankle sprain in a young high school athlete. We see shoulder arthritis in a 60-year-old industrial athlete. So we do a lot of different things, which I think keeps me interested. What I do is get people back to their activity levels. That's always the goal. If you like to go out and play golf, our job is to try to help you do that. If you like to go hiking or walking, our job is to help you get back to your activity level without pain. We try to be circumspect in what we do. So we don't rush to any judgment. We look for all the alternatives, all the options, and then do the necessary studies and workups to help pick which one of those options is best for them. So we have these different avenues, and sometimes patients, they want a quick answer, and there's not always a quick answer. Sometimes it takes a little bit of time to get there. But we try to be circumspect, and we try to evaluate them and communicate with them the disease process, what we can do for it, and where it's going to go if we treat it, where it's going to go if we don't treat it, what things they can do to help it, and what things we can do to help it. The best part of my job is when a patient who couldn't walk into my office 6 weeks ago walks out of my office. That's great, right? When they can walk out and they don't have pain, they're back to doing what they want to do. That's just great.